on this computer. Okay, good evening, everybody. It is Wednesday evening. It's Fertility Talk live on Facebook at 8 o'clock, and thank you for joining us. This evening, we are talking to Dr. Antoinette Ramos and Dos Ramos. Am I right? Dos Ramos, and she is from Supreme Fertility, or on behalf of Supreme Fertility. Tonight, we're talking about the relevance of inositol in male and female fertility. And inositol we always associate with PCOS, and it's the first time I'm hearing now it's also used when it comes to male for men as well. So we're going to hand over to Dr. Ramos, and thank you very much for joining us, Doctor. Thank you for taking the time out to do this talk with us, and we're really excited to have you do this talk with us this evening.
Thank you very much for the opportunity to be here with you this evening, and thank you to Supreme Fertility. Okay.
Awesome. It's a pleasure. And then I'd just like to say, so if you can please just give us a little background about yourself and about, about what you do on a daily basis and how you've gotten into this.
Okay, so basically I studied homeopathy. Homeopathy was my first degree. So I come from a family where I have a dad, he's a farmer, and my mom basically liked complementary medicine. So I went along and studied homeopathy. Little did I know that there's quite a lot of headwind when it comes to homeopathy. It's not a very well-received profession. And I'll never forget, I was in a seminar with Patrick Holford. I don't know if you ever listened to him ever. And he's a UK nutritionist, and I went to the front and I asked him, I was just convinced homeopathy would cure everything, and he categorically stated that you won't cure anything unless you get the nutritional deficiencies topped up. So you have to look at the nutritional status of a patient in order to treat a chronic disease. So that just got me a little bit encouraged, and I started studying quite a bit. And I just continued to study, and it eventually took me to the States, where I studied from here, but I did a fellowship at the American Academy of Anti-Aging Medicine in 2010, and then I finished that, and then I went and I studied at the University of South Florida, and I did a degree in functional medicine. Basically, it's called a Master's in Metabolism and Nutrition, and basically functional medicine is really where my heart lies. And if you ask what is functional medicine, it's really looking at a root cause of disease. And when I started to treat, looking at root cause, what is causing the symptoms, not treating the symptoms. Yeah, that's where I came to fertility. Yeah.
Wow. Okay. So is that you saying is that where your passion started, and about healthy pregnancies? How did that come about?
Yes. So that's basically how it came about. So I started treating patients. Now I'm treating patients and I'm looking for chronic disease. And remember, people come find us usually because they're struggling, they're not coming right in the normal mainstream. And then they come and find us. And when they come and find us, we start looking at root cause. And then by accident, people started to fall pregnant. And then a little bit later, I did a postgrad in fertility. And then you started to realize when you start to balance the hormones out and you start to remove the toxins from the body and you start to fill up the B vitamins or the folate or whatever's deficient, all of a sudden fertility starts opening up. And that's how I came to fertility, through people that are really, really struggling. And it was such a joy to see the patients actually starting to have babies. And it came through that, but I didn't go to treat fertility. It kind of came at me in a different way. So I've quite enjoyed the journey, yeah.
Oh, okay.
That makes sense.
Yeah, absolutely. Okay, so one of the main ingredients in Supreme Fertility, Supreme Wellness Folate, that forms part of the Supreme Fertility program, contains inositol. Can you briefly explain what it is and how it works?
Yes, so basically inositol is thought to be a B vitamin, okay? So it's obtained from our diet, and we get it in fruit and we get it in beans, but also the body can make it, okay? So it's synthesized by our kidneys. And then what happens is it's naturally occurring, sorry, and there's 9 different inositols, and there are 2 that are very important and that have been studied quite a lot, and they're called myo-inositol and d-chiro inositol. And the myo-inositol is the one that's found in nature quite abundantly, and they say that it's about 99% is found as myo-inositol, and then when we take our body makes it actually converts it to d-chiro inositol. And when we look at inositols are actually in our cell membranes. Okay, so if you have a cell, every single cell membrane contains inositols, and then inside your cell you've got a cytoplasmic membrane which also contains your inositols. So we've got like 30 trillion cells. They've each got little molecules of inositol. So we've got a significant amount of inositol in our body. So when we have a deficiency in the inositals are known to help with insulin signaling. So they help our insulin levels and our glucose balance. And so when there's an imbalance in inositols, we have an imbalance in our glucose regulation, and that leads to what they're saying insulin resistance, hyperinsulinemia, and the polycystic picture. If that makes sense.
I've actually had no idea. I've had so many talks on inositol. I had no idea that our body actually produces it. And you can get it in other things. I always thought, like, when it comes to inositol, it's always something that you just need to purchase. I think of my inositol, I'm thinking, okay, I need to buy a product, inositol, something that contains inositol. No idea that our body actually can produce it. Or it's found in sorry?
It makes it from glucose. It makes it from glucose.
Okay.
So it's very important for your listeners also to know that when you take an inositol product, you should always take it on an empty stomach. Otherwise, it competes with the glucose for absorption, and it doesn't work so effectively.
Wow. Okay. So so you mentioned there's 2 types of inositol. It's the myo-inositol and the d-chiro inositol. Is one more important than the other?
Yes. So the thing is with the myo-inositol, it's the most abundant one. And then what happens is it's usually found in a 40:1 ratio. So 40 molecules myo-inositol to 1 molecule d-chiro. But in the ovary, in a healthy ovary, they found up to 100:1 ratio in the ovary. And that's why we see a lot of initially when they started with the inositol supplements, we were looking at the d-chiro inositol, but later on, it's more the myo-inositol that we find in supplements. And also the myo-inositol is a lot less, it's more inexpensive because the d-chiro is quite an expensive product. So they did this study where they take a probe and they put it up into the lady's vagina, and they go into the little follicle, where the egg comes out of, and they take some fluid out. And in that healthy little one, they find that it's a 100:1 ratio. So the ovary is very much dependent on your myo-inositol more than your d-chiro inositol, if that makes sense.
Wow.
Yeah.
Yes.
So when you've got more insulin issues, you need your d-chiro inositol.
Okay. Is there any?
I'm not going to you.
Sorry. I think there's quite a bit of a delay. It's not you. There's quite a bit of a delay with the. I don't know what's going on with the connection at the moment, but is there any benefits for men to also drink inositol? So this is a very interesting question here, and I can't wait to hear what you're saying about this. Because like I said, I had no idea that men also take it.
Yes, so in your Sertoli cells, so there are these cells inside the testicle in the seminiferous tubule. So inside the male testicles, these Sertoli cells actually produce myo-inositol, and then when they stick a little probe in there and take fluid out, it's very rich in myo-inositol. So what they're saying is that 25 to 30% of men have what they call idiopathic, meaning unknown infertility. So they hand in a sperm count, they're given a sperm sample and they get a result back, and then it shows that they've got poor low count, or they've got poor motility, they don't move enough. And then there were various studies done, and what they do is they give them myo-inositol, and myo-inositol has definitely been shown to up the motility, so the sperm swims faster, and it helps as an antioxidant in the sperm. So it definitely has benefited fertility. You can improve, because remember also your sperm has got a far way to journey. So when the man ejaculates, it needs like 7 hours to capacitate, what they call. So it's got to come loose, and then he starts his long way journey. And if he doesn't have sufficient energy, he doesn't make the journey. And your myo-inositol has been shown to help with the energy for the sperm as well. And they did one study where they took thick ejaculate, okay, and then the other guys had normal, and then they compared it to another study where they had varicocele. That's where they got like
veins, yes.
Veins in the varicose veins. It's basically a physiological thing. So the myo-inositol didn't help in that study at all. But in the study where it was a thick ejaculate, it definitely improved the motility of the sperm. So it definitely helps, and also to remind the male patient to take it on an empty stomach, so that it doesn't compete with glucose. And then it should improve his sperm count if he looks at it. And I can tell you a whole lot of studies where they've actually shown it to be effective. So if your people Google it, you can actually check myo-inositol and sperm parameters. You'll actually see there's research articles that come up, and recent ones.
That's awesome. PCOS is one of the most common causes of infertility in women. What are some of the symptoms? So this is something I definitely know a lot about. I do suffer from it. I just actually want to put in there, I've actually, because of taking supplements, I've dealt with a weight problem for so long. I weighed myself today, and I've actually lost 10 kilos by just being on my supplements, and that's in 2.5 months. So I definitely know quite a lot about PCOS and dealing with the weight gain of PCOS and everything else that goes along with PCOS. So
so my heart goes out to people with PCOS, because it is really it's a very difficult condition. It's a very treatable condition, but it requires quite a demand. It's quite a demand. You have to make severe lifestyle changes, and the problem is genetically some people have got cravings. So it's easy for those people that don't have the cravings to say you shouldn't eat like this or you shouldn't do like that. But if you've got the genetics for that picture, it makes it incredibly difficult. I've watched the patients over the years struggle with it. Geez. So well done to you for 10 kilos.
Thank you.
Well done.
Okay, sorry, I didn't want to take away from your question.
No. So basically the symptoms, so basically what I understand is that when people usually have their first period, or if they've had substantial weight gain a couple of years later, they start with the symptoms of PCOS. And your symptoms, as you well know, is your irregular periods. So it's always to tell people if they've got, to make it easy to understand, if you've got less than 9 periods in a year, then you probably are looking at that picture. Second, if you've got increased androgens, which is the male hormone. And how do you know if you've got increased androgens? You've got the dark skin, the hirsutism. You can have acne. And if you just go into your doctor and they test your testosterone or your DHEA, those levels will be high. That's the second one. The third one is the polycystic ovaries. So you go into the doctor and they do an ultrasound, and then they find microcysts, usually between 2 and 9 millimeters, and more than 12 of them, or they find the volume of the ovary. It's big. Okay? So if you've got 2 of those 3, you usually are diagnosed with PCOS, and usually comes along with insulin, high fasting insulin levels, which your doctor will test. And then the problem with the PCOS that we all know is the infertility, the possibility of diabetes in pregnancy, the fatty liver, metabolic syndrome, hypertension. And then the big reason why I really believe we have to help ladies is it can increase your risk for female cancers later on in life. So we really have to help the people treat PCOS as well.
Absolutely. Okay, so then inositols are one of the supplements often recommended for PCOS. Do you recommend it, and how does it improve PCOS symptoms?
So with PCOS, there's a hormone called anti-Mullerian hormone. I don't know if you've heard of it or you've tested for it. Your AMH, So women usually with PCOS have high AMH levels. So then if I go back to a study where they did in 2016, they basically took myo-inositol and folic acid, and then they took the birth control pill, and then they let the woman drink it for 3 months. And that study showed that there was a statistical significant improvement in the myo-inositol folic acid group, and that improvement was better than the birth control pill. So yeah, so it definitely improves your polycystic picture. And I can just off the cuff will tell you that I've definitely seen it. It improves insulin sensitivity. It lowers insulin levels. It lowers cholesterol. It also increases your SHBG, which is a hormone that usually goes very low, which makes you have more male hormone.
Yes.
That also improves. So there's quite a few things that do improve with the myo-inositol. Yeah.
Okay, perfect. And then besides inositol, is there any other treatment you would recommend for patients struggling with PCOS, but not only PCOS for this one? When someone is dealing with infertility, what is some of the homeopathic recommendations you would give someone dealing with it? Someone coming, there's so many women that want to go, that's saying, I don't want to put certain things in my body. Let me do something, natural. What would you recommend?
Yeah, so that's where you look at, like with the metformin, is the side effects that people struggle. So, and that's why they find us. And with the natural treatment, so the first thing for me is to get weight loss to help them. But you don't have to lose 50 kilos. I try and break it down incrementally for the patients. There was another study done years ago where they actually showed the most significant improvement on PCOS was weight loss. So for me, it's to try and understand how the patients are eating, and then to try and help them to try eat 3 meals a day and no snacking in between, because when you're snacking, you're making more insulin and you're continuously making insulin. So when we eventually get people to help them with their appetites so that they don't crave, and that's where you use various different supplements. So you can use things like chromium, like magnesium, lipoic acid. It just depends, but those are nutritional supplements to help with insulin sensitization. That's one side. Then another side that where it's also been shown to be quite effective is melatonin. I don't know if you know melatonin. Yes. Melatonin helps with sleeping. But the interesting thing about melatonin is that it actually helps. It's a free radical scavenger. So when they look at the little inside that little egg, there's a lot of free radical activity that goes on if people are eating wrong or they're exposed to environmental toxins. So when we look at melatonin, we can actually we can help patients to sleep well. And when you sleep well, you know that you'll lower your cortisol. When you lower your cortisol, you'll regulate your insulin better. So increased melatonin lowers cortisol naturally, if that makes sense.
Yeah.
And then, so homeopathy is very different. People don't understand. They think homeopathy is vitamins. Homeopathy is not vitamins. It's homeopathic remedies like pulsatilla, like calcarea carbonica. That's usually where you go into a homeopath. They take your symptom picture and they try and match a remedy to your symptoms. That is, that's homeopathy. So people can try, but I find that homeopathy has to be in conjunction with functional medicine, and that's where I've had my success. I hope I'm answering what you're asking.
Yes, absolutely. I was going to say something else with regarding the sleeping thing. A lot of women don't know that when you also deal with PCOS, your sleep is completely out. I couldn't understand why I would be awake at 1 o'clock in the morning, 2 o'clock in the morning. I get 3 hours sleep. Sleep was like, if I got sleep at night, well, then I got sleep. But otherwise, I would be walking around here at 1, 2 o'clock in the morning. And that was also because of PCOS. So I don't know, maybe you could speak more about that.
So what I explain to my patients, when I studied in the States, they said before you treat a patient with anything, you correct their sleeping patterns. Because the thing is, if we look at the most important hormones, as far as I understand, is cortisol, stress hormone, insulin, the one for PCOS, and thyroid. Those 3 hormones work like in a triad. They work together. So a lot of the time, if people are tired, they just want to give thyroid hormone. But oftentimes, we need to look at our cortisol. So cortisol it's that hormone that when you get a fright, or you hear bad news, or you see something dramatic, your cortisol responds. You get adrenaline, you see the crash, or you hear the bad news, your adrenaline goes wild. After adrenaline comes out, your cortisol comes out. And when cortisol comes out, its job is to keep sugar in the blood, because you need to run, or you need to hide, or whatever you need to do. So when it loads that sugar in the blood, your insulin later has to come up to pull the sugar down. So we think insulin is the problem, but a lot of the time we have to look at cortisol, and cortisol keeps us awake. When you freak out and you're stressed out, cortisol awakens you. So you have to help patients. For me, We have to help patients to regulate their cortisol and get their sleep pattern back. We need it because then we get their melatonin back. If we don't get them sleeping, we don't get melatonin, and then we don't have our free radical scavenger there for free. Yeah.
Awesome. Okay, thanks for that. What is the best? I just want to actually check if there's any questions. I forgot to ask if there's anyone that has some questions with for Dr. Ramos. If anyone you have questions, please do ask. Or the other thing you can do is you can actually email her. How can they get hold of you if they need to speak to you, ask you a question?
So they're welcome to contact info@fertility.co.za, or they can call us on our office number on 012-346-7982.
Okay, awesome. Thank you very much for taking the time out to do this talk with us. I really enjoyed it. And you've given us a lot of information, a lot of good tips. Again, I really learned that men can also take inositols, and now we know what we can recommend men to actually take as well. So thank you very much for that. And again, we hope to have you again this year doing another talk for us. Have a good evening. Thanks, Doctor.
Thank you very much, Leanne.
It's a
Good
pleasure.
night. Good night,
Thanks.
everyone.
Bye.